Hello everyone, I'm excited to share how Health Information Management, or HIM, plays a big role in improving the quality and safety of patient care. We'll take a look at how managing health data accurately, securely, and accessibly can make a real difference in how healthcare is delivered. With HIM being the backbone of healthcare data, it keeps patient information accurate, secure, and easy to get to. This isn't just paperwork. HIM professionals helps doctors make safer decisions, keeps hospitals running smoothly, and even impacts the financial side of care. When the data is solid, everyone benefits, from individual patients to entire communities. Without it, errors and delays could ripple across the system, affecting care, quality, and outcomes. When we talk about health information management, it's really about making sure healthcare runs smoothly behind the scenes. HIM professionals keep data accurate because every detail matters when mistakes can affect patient care. They also make sure all the rules are followed. Through auditing and compliance, HIM keeps systems safe, protects patient information, and helps hospitals avoid errors. Then there's clinical coding. Proper classification of diagnoses and procedures might seem small, but it's how healthcare communicates and tracks the trends. Health information managers also make sure this part is done right. HIM doesn't stop there. They also turn data into insights. By analyzing and reporting information, they help healthcare teams make smarter decisions and spot areas for improvement. And finally, HIM makes sure information is accessible. Patients and providers need the right information at the right time, and HIM ensures that happens safely and efficiently. In short, HIM professionals are the quiet backbone of healthcare. They protect, organize, and make sense of information so both patients and providers can get the care and knowledge they need. Think about this. Every time a patient visits a hospital or clinic, decisions about their care are made based on the information in their health records. That's where health information management professionals come in. They're the custodians of health data, making sure that every piece of information is accurate, complete, and secure. Without this, the foundation of quality care and patient safety starts to crumble. Accurate health records don't just sit in a database, they actively improve patient safety. They allow healthcare teams to monitor safety culture, follow best practices, and spot risks before they become serious problems. In other words, good data literally helps prevent errors and keeps patients safer. But it's not just about the clinicians. Patients themselves benefit immensely from accurate records. When they can access complete and reliable information, they can make informed decisions, understand their own care, and feel empowered in the process. Transparency and engagement go hand in hand with accurate information. It's a partnership between patients and providers. And we can't forget about security. Accurate data is only valuable if it's protected. Maintaining the integrity of health information guards against unauthorized access, ensures regulatory compliance, and protects patient confidentiality. It's about building trust, keeping patients safe, and making sure the system works for everyone. So when we talk about data accuracy and security, we're not just talking about numbers or files. We're talking about lives, safety, and trust. Accurate, complete, and secure health information is the backbone of healthcare. It improves outcomes, strengthens operations, and empowers patients to take control of their own health. Let's talk about why data accuracy in healthcare really matters. Think about electronic health records, or EHRs. These aren't just digital filing cabinets. They securely store all of a patient's information in one place. With encryption and proper access controls, they keep sensitive data safe while giving doctors and nurses reliable information when they need it. But it's not just storage. Accurate clinical coding and regular auditing are crucial too. Coding ensures procedures, diagnoses, and patient information are clearly documented, which improves communication between providers and prevents errors. Auditing acts as a safety net, catching mistakes before they affect patients. Why does this matter? Accurate records can literally save lives. Up-to-date medication lists prevent dangerous interactions, and complete histories help doctors make the best decisions. Plus, reliable data improves the overall quality of care, helping teams coordinate effectively and maintain a strong culture of patient safety. And there's a patient angle too. When patients can access their own records, they can spot errors, ask informed questions, and feel more in control of their care. So when we talk about secure EHRs, coding, and auditing, it's not just about paperwork. These tools protect patients, prevent errors, and make healthcare safer and better for everyone. Compliance and auditing in healthcare might sound dry, but it's really about keeping patients safe and protecting their privacy. Basically, it ensures that hospitals and clinics follow laws like HIPAA and HITECH, so sensitive patient information stays secure. It also means checking that records are accurate and complete, including proper clinical coding, because mistakes can affect both patient and billing. Auditing rules for electronic health records help organizations stay accountable and operate ethically. And it's not just about the institution. Patients benefit too. When records are accessible but secure, patients can engage more in their care, which research shows can improve outcomes. Finally, compliance isn't static. It's a tool for quality improvement. By analyzing health data, organizations can spot trends, prevent errors, and make care safer and more efficient. So in short, compliance and auditing protects patients, empowers organizations, and ultimately helps healthcare work better for everyone. When we think about auditing in healthcare, it's easy to picture someone checking boxes, but it's so much more than that. Audits actually help us identify gaps and risks in our systems, from errors in patient records to potential security vulnerabilities. They're also key for keeping organizations compliant with regulations and accreditation standards, which keeps the whole operation running smoothly. But beyond rules and paperwork, auditing directly impacts patient safety and trust. By making sure health information is accurate and secure, we're not just avoiding mistakes, we're giving patients confidence that their care and data are in good hands. And finally, audits strengthen privacy and reduce the risk of data breaches, which is critical in today's digital healthcare world. So really, auditing isn't just about oversight. It's about building a safer, more reliable, and trustworthy system for everyone. Let's talk about clinical classification and coding. At its core, this is all about turning what clinicians write in a patient's record into standardized codes, like ICD-10, CPT, or SNOMED CT. You might think of it as translating medical language into a universal system everyone can understand. Why does it matter? Well, these codes don't just help with billing. They're essential for research, reporting, and supporting decisions at the point of care. Accurate coding directly impacts patient safety because errors in documentation can lead to mistakes in treatment or delayed care. On top of that, structured codes make it possible to analyze healthcare data. Hospitals can track outcomes, improve quality, and even spot patterns that help prevent errors in the future. So while coding might seem behind the scenes, it's really a backbone of safe, efficient, and high quality healthcare. Let's talk about why accurate clinical coding really matters. First and foremost, it keeps patients safe. When diagnoses and treatments are coded correctly, it reduces the chance of errors and helps clinicians provide the right care. But it's not just about safety. Coding also drives quality improvement. By tracking outcomes accurately, hospitals and clinics can see what's working, what's not, and make informed decisions to improve care over time. It's also crucial for the financial side of healthcare. Accurate coding ensures that claims are processed correctly, so providers get reimbursed fairly and patients aren't hit with unexpected bills. And for patients themselves, proper coding means their records are clear, accessible, and easy to understand, which helps them be active participants in their own care. Finally, coding protects the integrity of health records and keeps data secure, helping organizations stay compliant with privacy regulations. So while it might seem like just paperwork, accurate clinical coding really is at the heart of safe, efficient, and trustworthy healthcare. Let's talk about what data analysis really does in healthcare. Simply put, it's all about collecting and looking at health information to spot trends, uncover risks, and find opportunities to make care better. But it's more than just numbers. These insights help healthcare providers and administrators make smarter, evidence-based decisions and drive quality improvements that actually make a difference. Data analysis also plays a big role in keeping patients safe by flagging potential errors, monitoring adverse events, and making sure records are accurate. It helps prevent mistakes before they happen. And finally, it keeps sensitive information secure. Strong data security and privacy practices protect patient records and build trust, while making sure the information remains reliable and compliant with regulations. Now, let's dive into the tools and benefits of data analysis and reporting in healthcare. First, dashboards. Think of them as real-time windows into quality metrics and patient safety indicators. They let healthcare teams spot trends as they happen and act quickly when something looks off. Then there's predictive analytics. This tool helps us see patterns and anticipate potential risks. By looking at past and current data, teams can take proactive steps to prevent problems before they occur. And now don't forget, we have clinical coding and quality metrics. Accurate coding isn't just paperwork. It ensures the data we use for reporting and monitoring is reliable, which is essential for patient safety and compliance. So, what's the benefit? First, we get early detection of safety issues. By analyzing the data, we can catch trends, near misses, and high-risk areas early, preventing harm before it happens. Next, it informs prevention strategies. These insights guide targeted interventions and help drive ongoing quality improvements. Finally, these tools help strengthen the culture of patient safety. Transparent reporting and accessible information encourage accountability and trust among both staff and patients. So when we talk about information accessibility in healthcare, we're really talking about making sure the right people have the right information at the right time. This includes clinicians, patients, and even payers. Everyone who needs the data to provide or receive care. Having timely access helps avoid duplicate tests, keeps care running smoothly, and ultimately empowers patients. When people can see and understand their own health information, they're more engaged and better able to manage their health. From a safety perspective, accurate and up-to-date information is critical. It helps providers make informed decisions, reduces errors, and improves outcomes. And behind the scenes, proper management ensures data is accurate, coded correctly, and kept private. So accessible health information isn't just convenient, it keeps patients safe, supports high quality care, and builds trust across the system. Here we're looking specifically at information accessibility from a health information management perspective. It's all about how patients and providers can easily and safely get the information they need exactly when they need it. One key tool is patient portals and secure EHR access. These lets patients log in anytime to see records, lab results, or visit summaries. That control helps patients catch mistakes and stay informed, which studies show improves safety and engagement. Another critical piece is interoperable EHR systems. This ensures patient information moves with them, whether they're visiting a specialist, get referred, or change providers. Interoperability means fewer repeated tests, less confusion, and better care decisions. And of course, all of this relies on strong information governance and audit controls. These systems protect privacy and security while still allowing authorized access, building trust in the process. Together, these methods show how HIM professionals balance access, safety, and trust to create a smoother, more connected healthcare experience for everyone. Here's a real-world example of why access to health records matters. A 2017 ONC report found that patients often struggle to get their own health information. These delays sometimes led to duplicate tests and slower treatment. HIM professionals step in to make sure records are secure, timely, and compliant. When access works the way it should, it improves patient safety, supports better care coordination, and builds trust. This real-world example really highlights HIM's role in protecting patient record access. Data accuracy and security make sure information is complete and verified. Compliance and auditing ensure we follow the HIPAA right of access. And information accessibility make sure records are available when they're needed to support safe care transitions. Together, these functions help prevent delays and errors, ultimately improving outcomes for patients. When we think about the impact of health information management professionals, it really touches everyone in the healthcare system. For providers, HIMs help make care safer and more efficient by ensuring records are accurate and risks are monitored. For payers, that same high quality data helps make claims more accurate and reduces the chance of fraud. And for patients, it builds trust. Secure, accessible records mean people feel safer and more engaged in their own care. But HIM professionals don't just manage data, they educate staff, enforce compliance, and foster a culture of patient safety. Essentially, they're the quiet force behind smoother operations, safer care, and happier, healthier patients. It's a role that might not always be in the spotlight, but its impact is enormous. In conclusion, health information management professionals play a critical role in healthcare, connecting providers, payers, and patients through accurate, secure, and meaningful information. Their work enhances safety, efficiency, and trust, while fostering a culture of continuous learning and patient-centered care. By supporting HIM professionals, healthcare organizations can ensure better outcomes for everyone. Thank you so much. Hope you enjoyed my presentation.